Hello, everyone, and welcome. I wanted to introduce you to a new piece of Medicare news here in July of 2026. CMS has decided to end temporary subsidies for Medicare prescription drug plans. Now, this article that was recently published in a couple different places, including here in the Kaiser Family Foundation, can feel a little bit confusing, but let me try to simplify it as easy as possible for you. A couple of years ago, they passed the IRA, or the Inflation Reduction Act, which one of its main purposes was focused around reducing Medicare prescription drug costs. They did this in a couple ways, but mainly they put an out-of-pocket maximum on what people could spend in a standalone prescription drug plan or in a Medicare Advantage plan. Now, that cap is great for the consumer. Essentially, back in 2024, they had a cap of $2,000, so they could never spend more than $2,000 on medications. Unfortunately, when it came to extraordinarily expensive medications, the insurance companies are now picking up everything on the back end above and beyond that $2,000. Now, there are other people that chip in to this picture, but essentially, the consumer now pays $2,000 at the most, and then the insurance company picks up the majority thereafter. Now, essentially, insurance companies' first solution to picking up all this extra money in drug plan costs was to raise their prices. But the IRA also stipulated a cap on how much they could raise those prices and subsidize them a certain amount of money so that they wouldn't raise their prices too far. As of now, for 2027, they've ended this subsidy program so that essentially they will no longer subsidize prescription drug plan companies to keep their monthly premiums low while keeping that out-of-pocket max in force. Generically put, standalone prescription drug plan prices could rise significantly without this subsidy. The subsidy has slowly been cut back from year to year, and now, based on this article and some other information, they think that the prescription drug plan companies have enough data to figure it out, for lack of a better term, on how to make these plans affordable while keeping that out-of-pocket cap in place. So, what does this mean for the consumer or the Medicare beneficiary? As we saw in years past, at least here in states like New Jersey, prescription drug plan monthly premiums have increased. That may continue to happen next year, especially as these subsidies the government was providing to keep the cost low disappear. Now, sadly, prescription drug plan companies typically run these premiums on a national average, meaning the price could be low in many states, but that could be extremely high in other states, and meeting in the middle or looking at their average is where they're pulling that number to keep everybody feeling good or publicly to make themselves look good. So again, keep in mind, subsidies have existed the past 2 years where the government was paying out money to prescription drug plan companies to help them keep the monthly premium low. That will now end as of 2027, and we may see an increase to monthly prescription drug plan coverage. Keep your eye out for more information. We'll be happy to share it with you as soon as we find it.